Hello and welcome to the IJA podcast. Today we are excited to feature a very prominent anesthetist from Nigeria, Professor Elizabeth Ogboli Nwasor. A graduate of the Ahmed Bello University, she has an impressive track record that includes fellowships in anesthesia, Master of Public Health, and significant leadership roles, such as immediate past president of the Nigerian Society of Anesthetists, council member of the WFSA, and she is the current president of the IASP Pain Education Special Interest Group, and also the Society of the Obstetric Anesthetists of Nigeria. Professor Nwasor has received numerous awards, including the 2022 IASP Award for Excellence in Pain Research and Management. With over 40 published articles and 5 medical books, she is a leading voice in obstetric anesthesia, pain management, and palliative care. Join us as we dive into her inspiring journey and her contributions to global healthcare. Professor Nwasor, it's an honor to have you here.
Thank you very much. I'm glad to be here.
Let's get a sense of how your journey started. So, from your younger days, when you wanted to be a doctor, what was the impetus for you to take up anesthesiology as a profession?
Okay, thank you very much for that question. Well, when I wanted to become a doctor, I didn't really, from the beginning, want to become an anesthetist. I wanted to be an obstetrician and gynecologist. And, well, somewhere along the line, there was a change or a twist in my plans because I got employed into the anesthesia department of the College of Medicine in University of Calabar Teaching Hospital. And my mentor, Dr. Sylvia G. Akpan, now Professor Akpan, she said, forget about obstetrics. I'll make a good anesthetist out of you. And that's how the journey started. And I said, okay, fine. And here I am today. So that's it.
So that is quite relatable to me because I initially wanted to be an orthopedic surgeon. And then I made the switch to being an anesthetist. I also read this concept about being on the lookout for emerging opportunities. I think this is all about looking out for emerging opportunities when it comes to us.
Yes.
On a related question, I wanted to ask you, is being a doctor an aspiring profession in Nigeria? What were the challenges that you faced on your journey when you started out?
Yes. Well, until now, the choice of medicine or MBBS or MBCHB to the College of Medicine is still the top choice in Nigeria for science students who want to go to the university. Well, it is very highly competitive. Only the best get into the few medical schools in Nigeria, and then some others have to study abroad or get scholarships to study abroad, especially those whose parents can afford the fees, because most of the time it's very expensive and the payment is out of pocket, not by government or anything. So yes, it's highly competitive, and yes, it's a top choice. For me, when I started out, it was quite difficult first to get admitted into the Medical College of Ahmadu Bello University. Ahmadu Bello University is one of the top 4 universities in Nigeria, and so it's called one of the the 4 first-generation universities, and also one of the top 4. And so it's very difficult to get admission into the school to study medicine. And then when you get admitted into the school, there's so many hurdles you have to cross. First, you have to pass the first MB, and then you have to cross the second MB. So at those points, there is what we call weeding, the weeding stage. That's the time that only the strongest candidates can proceed because you get weeded out. That's the word that is used. Many people get thrown out of the school, withdrawn, or they have to repeat some years or something like that. So, but eventually we're able to scale the hurdles, and then once you're able to get into the clinical school, you're pretty sure you will graduate. And then Yeah, that's it. We're here. I'm here today. So it was challenging and difficult, but what I can say for the younger ones is just you've got this, knuckle down, put in your best, and then with the help of God, you will scale through. That's what I can say.
I
Thank
have
you.
to say, Professor Nwasor, that is such an inspiring journey. I'm sure you must have had a lot of mentors along the way. So in India, we believe in the Gurukul system where the Guru shows the disciple how to have excellence in their journey. So what is your experience with mentors? How important it is to find the right mentor to have professional excellence?
Yes, thank you very much for that question. In the opening, I mentioned Professor Sylvia G. Akpan, and I want to say that she's been my top mentor, even till date, because she just felt that no, you will do better as an anesthetist, and then she kept at it, showing all the things to be done, putting us through, not just me, but quite a handful of us that went through her. And, being a very strict disciplinarian, she's not faced by anything really want to complain about. Rather, she'll encourage you to try to get over it. And then she had this motherly way of, you know, teaching you, even though being strict, but also being caring as a mother. She will want to know there are personal issues that you need to address. Should want to know if there are any economic problems like money, like salary, and she will go out of her way to try to solve it, to make the mentees more comfortable. So we found her input very, very, encouraging. And I must say that she's a star where, to me and to many of us. Yes. So that is the role of one mentor. I have other mentors after the fellowship stage. When I went into pain management, Professor Lighton Soyawo, who is the founder of the Society for the Study of Pain, Nigeria, she also took me up and said, okay, come in, don't worry, I will take you through this. And right from those days, I was a senior registrar then, and I was visiting in her department because I needed to do some postings in the department in University College Hospital, Ibadan. And that was how she took me into the IASP, introduced me to it, and then the SSPN, as the Society for the Study of Pain Nigeria. And she has continued till date. Even when I needed to apply for some fellowships, she's able to, you know, give the necessary guidance, advice, and, generally counsel me to do what is the right thing. And I'm very grateful to her and many others that have really, you know, made a great impact on my career as an anesthetist. Thank you.
So we have ups and downs in our career all the time.
Mm.
In a career that spans so many glorious years, can you share 3 moments from your life when you felt this immense joy and you felt on top of the world?
Okay, yes, why not? Um, there are so many moments, but I can just pick the top three. When I was when I passed my fellowship exams to become a fellow and be appointed as consultant anesthetist, that was a big high in my career because at that time the fellowship pass rates were very poor. Very few people got to that stage, and then the few that got there, it was really a yeoman's job. It was a Herculean task to pass and get through with the fellowship exam. So when I passed it, I felt really, yes, I got this. And I was very happy. So that's one top point. And then the next point is when I got promoted to the rank of professor in Ahmadu Bello University. I had already been appointed as professor in another university earlier on, in Bingham University, which is an equally good university, but it's a privately owned university owned by faith-based organization. And because I've had all my career in Ahmadu Bello University, and I really wanted my professorship to be from Ahmadu Bello University. So I wasn't done yet. I just said, well, okay, I'll keep that in my kitty and keep working towards the professorship from the Ahmadu Bello University. So about 2 or 3 years later, after that initial appointment as professor, I now got appointed in the chair as professor in Ahmadu Bello University. And that was a really big moment for me because I was going to be the first professor in the department. Somebody else had been promoted, but had left the services of the university. So it was like, wow, this is it. So that was another big top moment for me. And then you said 3, right?
Yes.
Okay, well, the third one I would think would be when my husband was promoted as to the rank of general in the Nigerian army. It was his promotion, not mine, but it was like, it was like a very big thing for me because also he had gone through a lot of stages and a lot of difficulty. I don't know the Indian army, but in the Nigerian army, it's so difficult to become a general. There's so many hurdles and so many things to cross. And so when he was promoted, that was a big aha moment for me. Thank you.
I asked for 3 achievements, and one of them was a personal accomplishment of your spouse. I'm so glad that you mentioned it. Does this mean you must be a very family-oriented person?
Oh, yes, certainly. For me, family is top because all through my career, well, initially when I started out, I wasn't married, and then I got married as a senior registrar. And then my husband has been extremely supportive. He was there all the while, all the exams, all the difficult times, and sometimes he'll have to take care of the children when I have to go for exams or go for update courses, refresher courses, revision courses, and then sometimes for long period of times, he was my biggest cheerleader. And even when I was writing my thesis, my dissertation, even though he was not in medicine, but I would say, please help me with the proofreading. And he would do an excellent job, at least for the English and other structural components. And so I really felt, so family for me is top. And so, the accomplishments are shared achievements, not just individualized, both on my part and on his part. They are shared achievements. Thank you.
Something that I always ask to people who are in obstetric care. Parturients are the only category of patients where it is acceptable for patients to experience pain while being under the care of a physician. Now, there is a lot of change over the years in this, but still you see in some parts of the world, especially in obstetric care, I believe, there is a tendency to normalize pain. What do you think of this as being in the obstetric care for so long?
Well, yes, for me, it's a big no-no. I don't think it is right to normalize the pain of labor. I don't think it's right to normalize any pain whatsoever because pain is uncomfortable. Pain is, it brings out the worst aspect of somebody. And even on the social component, it causes a lot of limitations to the patient's activities and all that. So I am very passionate about pain relief in labor. And it stems from my personal experience with labor. I dare say, I don't know about other people's experience, but I had the most terrible and most traumatic ever experience of labor. It was so bad. Um, it was unbearable. And I was asking for pain relief. And I was saying, I will mention the drugs, give me this, give me that. And they would say, no, we cannot give you this. No, it's not allowed. No, the doctor has not prescribed it. No, the obstetrician does not allow this. And it was so bad. It was terrible. I was prostrate. I was just at the limits of what I could bear. So eventually I had to ask for a cesarean section. And I earned the cesarean section anyway. And that's how we say it. You earn the cesarean section. I earned it because eventually it was like they agreed that the labor is delayed, prolonged, and became obstructed. So I had to have the CS. And that was what put an end to my misery. But you know what? That very unique experience just triggered off something in me, and I am very passionate about pain relief in labor. And when the ISP, there was this opportunity for a grant, I wrote a proposal about a grant to teach about pain relief in labor all over Nigeria in the 6 geopolitical zones. And that was in 2010. I eventually got awarded the grant in 2012, and I did the project. I went around the country and told the story of pain relief in labor, started off so many pain relief in labor units. And I dare say the one that was started in my hospital was because of that effort. We made a lot of write-ups, a lot of publications. I had this committee because when I won the grant, I presented it to the hospital and to the university. And I was very lucky that my chief medical director was very supportive, and also the vice chancellor. And they said, look, you've got this. Just whatever you need to do this, we'll give you the support that you need. So I had all the support I got. I was able to, build a team of pain relief in labor. And we were able to now start a pain clinic as an offshoot from that, and a pain relief in labor group. And now participants in Ahmadu Bello University Teaching Hospitals area, they can request for pain relief in labor. And we were able to buy kits and the things, the consumables, and we can give it to them free of charge. Those that are enrolled into the, into the grant project, into the project. And now it has continued as a program in the hospital. And even when I'm not around, some people will call me and say, this, and I'll say, no, I have people that you can contact. I'm away, but this person will handle it. And so that's how it's been. So, yeah, we should not normalize any pain whatsoever, but more so, we should not normalize labor pain because it's distressing and it really can be a source of concern. And many women have developed PTSD from unrelieved labor pain and other pains. So I'm very passionate about it, and I don't think it's right to normalize any pain, let alone labor pain.
Did this inspire you in any way to take up pain medicine as a target area for your research and your work?
Yes, certainly. With that grant, we had so many publications. We had about 3 publications from that. I did some more research on other aspects of pain. I worked on neuropathic pain. I worked on pain in cancer patients. And so I told you that is what led to the formation of the pain management group in my university. So we now have a group of people from all the specialties of medicine and also from the allied health, nurses, pharmacists, physiotherapists, even, community health extension workers, social workers, and patients' relatives, and all advocates of pain management and pain care. We even have spiritual leaders, from all the different faiths as members of the committee, because also that pain has the spiritual component, and that is a very big aspect in Nigeria. If you really want to do pain management, you have to involve everybody. So yes, that experience stimulated me to do a lot of research on pain management. And I went on after that to do I got another grant to work on neuropathic pain, and another grant again to work on pain in cancer patients. And after that, we were able to compile a book based on all the presentations we did and so many things, to have a book on pain management in palliative care in Nigeria. And it's there, it's available, it's on sale, and it's got the IASP because it was partly funded by the grant money from the IASP. So it's got the IASP logo on it, and yeah, so that's it. Thank you.
You've been a council member of the WFSA as well.
Yeah.
Now, WFSA has stressed on the importance of healthcare advocacy by the anesthetist. And they believe that anesthetist has a very important role in leadership, in global leadership. Now, do you think there is equity in pain medicine? Do you think everyone has equal access to pain relief in the world? As an anesthetist and as a person who has the ability to make policy changes, what do you think can be done to bridge this gap?
Thank you. You've asked so many questions in one, like 3 or 4 questions now. Okay, talking about the equity, there is no equity. There is poor access to pain management and to anesthesia care in general, across the world, especially in the lower income countries. When the Lancet Commission did this research, they found that most of the places that needed pain relief and opioids had the highest burden of disease, of cancer, and things that require strong opioids, but had the least access to these medications. And so that's the irony of it. And that's why that's why I say that there's no equity at all. So you have the low-income countries having the highest disease burden and the highest need for even simple basic anesthesia and surgical care, having the least access to those kind of things. And there are so many factors that are responsible for this. First, the topmost is the issue of resources. There are no funds. There's no funding for some of these things. It's not a cancer care, for example. It's not a fast sell like let's say, what do I want to say, like HIV/AIDS or of recent COVID-19. Cancer, but cancer is there healing more people than all these things put together, but there is no emphasis, no focus on it. And then the research on the cancer, maybe because it's not bringing a lot of money or a lot of publicity, I don't know. But even the people in the industry, they are not doing enough to take care of the burden of disease of cancer and of even the simple surgical conditions that can be solved that require anesthesia. We don't get access to it. So there is no equity. The low-income countries, where most of these countries are in Africa and Southeast Asia. And most of these problems, we have a lot of burden of these problems in Nigeria, especially because Nigeria is the most populous Black country and because it is at the trigger point of Africa. If you hold Africa the other way around, it's like you are holding a gun and Nigeria is just at the at the trigger where you can just pull the trigger. And so whatever goes wrong in Nigeria, people say is likely to spread around the whole of Africa. So I dare say that there is no equity and more needs to be done. We need to speak out. We need to be advocates for proper care, advocates for adequate anesthesia services, advocates for adequate pain management or pain care to get across to the millions of the populations of people. Then the other thing you were talking about is about do I think if as leaders we can talk or we can be a voice? Yes, of course. That is one of the roles we need to do. We need to play. We need to strengthen it. WFSA is beginning to do it, but I think we need to do more. I think we need to do more at different sub-regional and national levels. We need to involve key state actors to be able to address these problems. We need to involve individual governments. For example, if you get something to do at the World Health Assembly or WHO and all that, it may not trickle down to the member state of the WFSA. It's because there's a hierarchy. It takes a long time before it gets to the member state and then to the individual members and then to the community. It's going to take a long time. So I think that there should be breakouts. There should be a mainstreaming of this message down to the different levels, the subnational levels, and to the different governments. You know, key stakeholders need to go out there and talk to the governments, people that are able to affect policy and make positive change to get to solve these problems. And it should not just be talk, because talk is cheap. It should be actionable points. It should be based on strategies that can change the way things are going. You know, if you just say, okay, we need to have more analgesics in Nigeria, for example, how do you go about it? You need to have more opioid analgesics. There should be actionable points. There should be a way to get to deliver those getting more opioid analgesics in Nigeria, not just to talk about it and say, okay, there's a policy. So how does it get there? So that is the gap. Those are the gaps I see, which I think we need to bridge these gaps. And that's why I'm happy that in my role as council member for the WFSA representing Africa, I have been able to attend the World Health Assembly in July in Congo, Brazzaville, and there we made some statements about pain management, about anesthesia care, and the statements were read at the World Health Assembly for the African region. But beyond that, we should be seeing these things taken by the different member states of the African region and, you know, running away with it and, you know, really implementing it in their countries. That is the aspect I see that has not been done. And I'm hoping that as we go on, we can bring up strategies to help us to get into the different member states and really impact positively on them. One of the things I see that is being done, which is good, is getting the young early career members, so the younger anesthetists involved, because I believe that they are game changers and I believe that they have a lot to offer in their different unique ways. So I was privileged to nominate some 3 African representatives into that working group. And I'm hoping that they will be able to deliver the goods, at least to reach out to the younger ones, catch them young, and then together we can take the message and run with it.
I could sense a lot of passion in that answer.
Yes.
And you mentioned global collaboration. So you've been in the global leadership for so many years. How important it is to collaborate with other member states to bridge the gap between knowledge and skill?
Yeah, it's absolutely one of the most important strategies to do. I believe now that global health has come to stay, and collaboration is part of the sustainable development goals. And I believe that every country should key into it, and every organization, like WFSC, should key into, because you can't do it alone. And like they say, no man is an island. If we're not strengthening partnerships and collaboration, it will be extremely difficult to achieve the ethos, to achieve the goals that we want to achieve as WFSC. So I dare say that we need to do more of collaboration and more of partnership. And that's why I'm so happy that I was invited by Dr. Balavankat to be here in India, because this is a beginning of a lot of collaborations between our countries and our societies, the Nigerian Society of Anesthetists and um, the Indian Society of Anesthetists, and by extension, other countries in Africa and other countries in the Asian region, so we can together, make it better and, achieve more. It says that if you want to go far, you go alone. But if you want to go fast, you go alone. But if you want to go far, you go together. You go with a team. You go as a group. So that's what I think we should do now. I think we should do more of collaboration. I think we should do more of partnership. And I'm really very passionate about it, because I see that nobody should be left behind. Nobody should be left behind. So now what we're doing is to encourage the smaller countries, some with 2 million people, some with 5 million people. We're saying, okay, just send anesthetists, we'll train them. So in Nigeria now, we have 5 Liberian people. There were 8, but I think 3 dropped out from Liberia. And, because before about 8-10 years ago, all the anesthetists in Liberia were coming from the US or from Nigeria or from any other country. Even currently, the consultant anesthetist in Liberia is a Nigerian doctor. But what we suggested to WFSC, and they took it up, was to send people to Nigeria for training, because maybe they can't afford to go to US or UK, and if they will go to US, they may not go back to Liberia. So we said they can train in the region, and then they will sign a memorandum of understanding, and then they will go back to their countries and serve their people. And then you don't have to have the high mortalities you're getting from people conducting anesthesia who are not well trained. So right now, we have about 5 who have finished the DA, and Dr. Meme is still in Nigeria. He stayed back so that he can finish the fellowship. And they're all there now working and giving back to their country. So with that, we're doing that for other countries. In Nigeria, we're trying to encourage other people to, send people to us. We can train them. And it's a win-win. In the end, we get better. Everybody wins. Everybody gets something out of it. So that's what we're doing. So I believe that we can do more. And we're open to more positive strengthening of the partnerships and collaborations that we've started.
Everybody wins, isn't it?
Yes, everybody wins.
But in a successful journey, I've observed resilience is a very key theme. Now, there must be moments in your life also when you felt that you deserved more. Now, for the youngsters out there, can you tell us how you bounced back from those negative emotions? And how did you transform yourself into being this resilient person?
Thank you very much for that question. Yes, I think the resilience is really important, because these days we're having a lot of burnout, and we're having a lot of stress-related issues and disorders, especially among the healthcare providers. And the anesthetists are not exempt. In fact, anesthesiologists and people that work in ICU have been known from research to have a high level of stress and burnout. And so we need to develop a more resilient workforce. Well, yeah, in the early days, I had some challenges here and there. There was a delay in my promotion to professorship, and then I felt I should have been promoted long before I eventually got promoted. And then it was very difficult at that time. It was very challenging. I felt underappreciated and, but then how I overcame it was, I said, okay, well, I'll just do more work. That's what I said. I said, okay, I'll just do more work. So if I needed if they needed 20 publications to get promoted to professor, I'll do 40. Yeah, and that's what I eventually did. That was what I eventually did. I said, okay, if you need one book, I'll write 5. And so that's what I did. And then again, with a strong belief in God that as we're making our own personal and individual effort as human beings, God is blessing it with more success. So, and then I just said, well, okay, I'm here. I'll just hang in there. And when you stay longer in a place, you should get better. So that was my principle. Staying longer make me better. And so I just got better and better at what I was doing. And by the time I knew it, the promotion was out, and then I had made names in certain things. So everybody will say, oh, okay, we know how. No, is it not that person that is doing pain relief and labor? Oh, is it not that person that is talking about pain management? Or is it not that obstetric anesthetist? So in the end, it was an adverse period, It stretched to about 8 to 10 years. It was not a pleasant time, but I think in the end, truth will always win over adversity or over difficulty. So that was how I got over it. So my advice to the younger ones is don't give up, don't lose hope, just do it better. Keep getting better and better. If there's any area you need to look at, do some introspection or whatever it depends on you to improve, do the improvement and then keep at it. Don't lose hope. There's light at the end of the tunnel. Hopefully it should be a short one. So that's it. Thank you.
Just hang in there. Things are going to get better.
Yeah.
If you ask me to do 20 publications, I will do 40. What a brilliant way of looking at life. Professor Nwasor, it was such an honor to have this lovely conversation with you. I have personally been enriched by this heartful moments. Thank you so much for being with us.
Thank you.
That brings us to the end of another episode of the IJA podcast.